Can I say being a Black OBGYN is actually really hard because of this? You know, the father of modern gynecology is, Dr. Marion Sims, who has been glorified and in some meetings are still glorified. And I'm just sitting there like very like cringe, like really people are still praising this man who was able to develop techniques on enslaved women without their consent, without giving them pain management, right? That is like the fundamental history of GYN. And I actually hate to say history because it's currently going. There's lots of videos that will show that people are experiencing pain and they're not being listened to. And then and that's in terms of like IUDs. Then you start looking into maternal mortality and how people are dying. And then when you look at Black women, they're dying at like 3 to 4 times more likely than other women. So it's hard. And I'm also post-call, so this is probably very unedited in what I'm saying. But this like being in a position of being an OBGYN, feeling very privileged of taking care of people, but then also being a Black woman and knowing how dangerous it is to being a Black woman seeking reproductive health care. It's like a very weird, position that I live in. That sometimes when I'm talking, I actually, like, to be frank, I don't know if I'm talking as a Black woman with my lived experiences or talking as an OBGYN that's been trained in this like medical complex industry to see patients, see things in a certain way. And the way that I see things as a provider, that I've been taught as a provider, isn't how being raised I should be seeing patients at. I hope that makes sense. It's probably a little bit like confusing. And I'm also post-call, so I'm probably also very delirious as well. But fundamentally, there's a lot of things that need to be changed within our healthcare system. And sometimes looking back as to how we became a specialty is truly important so we don't continue to repeat those horrendous acts.